So Guardant has developed a unique way of finding small fragments of the tumor genes in the blood. What we find in blood, fragments from the tumor, is called circulating tumor DNA. And it's a very, very tiny amount, but Guardant Health has been able to tag, to match, brand these molecules in a unique way so that we are able to find them and then place them into a sequencer. And this allows us to learn about the biology of the tumor, real time, the moment that the disease is happening, for any stage of cancer. What we look at is tumor fragments from the genetic code, what we call DNA. It's not cells, it's fragments of the genes of the tumor. And the technology is very, very, very sensitive. So tiny amounts that we call down to 0.1, 0.2% of what we call a variant allele frequency. It's a tiny amount of mutated DNA is what it can detect, and the specificity is practically 100%. So when we detect it, it's a real positive, and it allows you to take a therapy decision. The technology is obviously focused on helping clinicians to treat cancer patients. So we have to be sure that the technology is highly validated. And to do this, we have done a lot of analytical validation. We have shown how good the liquid biopsy performs. We have shown the clinical validity, and then the most important thing, the clinical utility. We have shown how this is helping identifying biomarkers better, understanding the tumor better, and treating patients better, which results in better outcomes. This has gone through now more than 500 publications in the best oncology journals in the world, hundreds of communications in the principal conferences, and it has been the first liquid biopsy in advanced cancer to get an FDA approval and an IVDR mark for Europe. So the levels of validation are extremely high. And last year we reached over 1 million patients tested with the technology. All the international guidelines, the American guidelines, but also the European guidelines, already capture that liquid biopsy to look at the genes and the biomarkers of cancer are very helpful and should be applied for all advanced solid tumors. The European Scientific Society, the ESMO, is covering this in the guidelines. And when you don't have tissue, or as a complement to tissue, you should always sequence the blood before treating a patient. For the future, what we are looking right now is to explain the clinical utility in early stages of disease. So when we operate a patient, when we go a colorectal cancer, breast cancer, lung cancer, you go to surgery, and you want to know, does the patient now need chemotherapy, radiotherapy? You want to look at minimum residual disease. Have I cured the patient or not? This is what we are demonstrating now, that we are able to pick this up very early. And the next phase comes into screening, healthy population, where we are able to pick up a cancer signal in blood up front. And in fact, just in August this year, we have received the first FDA approval for a liquid biopsy screening test in colorectal cancer.